Welcome to the Practice of Medicine podcast from the Southern Medical Association. Since 1906, the SMA has had a singular mission to provide medical professionals with the resources they need to learn from each other, and in so doing, to improve the overall quality of patient care. The Practice of Medicine podcast is just one of the ways we do that, as we discuss a wide range of topics, including multidisciplinary approaches to patient care and new innovations in medical technology. To learn more about SMA's many other services and educational initiatives, please visit us at sma.org.
I'm Dr. Lisa Fitzpatrick.
And I'm Dr. David Malebranche.
A primary care provider referred a patient to me because frankly, he was a bit embarrassed because I had been speaking to him for some time about routinely screening his patients for HIV. And he'd been screening his patient for cancer. And after all the CT scans and all the x-rays and laboratory tests were negative, he decided, well, what do I have to lose? I may as well test her for HIV. She had a double-digit CD4 count. So he referred her to me. And, it's just, I can't believe we are still here. And I think it's worth talking about some of the barriers to HIV, to routine HIV screening. Like, why is this still happening?
Yeah, it's such a complex and nuanced topic. I think, when it comes to testing, I think, your example, your story is one of the primary barriers in my eyes, which we can flip to a facilitator if we approach it right, which is, the providers and the staff ourselves. So based on our implicit bias, we may see certain people as quote unquote higher risk for HIV, or we may screen certain populations more based on that. But the fact of the matter is, in this day and age, we're almost in 2021, HIV screening and testing should be a part of routine healthcare, and particularly given the dynamics of how this is related to sexual behavior and the reluctance not only of providers to ask sexual behavior and sexual history questions, but also of patients being afraid to be stigmatized or judged by said providers for being honest about their sexual behavior. So I think it's on both those levels that the testing, it can be problematic. I think obviously a lot of people may not prioritize HIV testing because we don't see people and we don't get the images of people dying and transitioning from complications of HIV the way we did in the 80s and the 90s. The medications are really good. So maybe people have laid back on it a little bit and said, well, this is not as big of a deal as it was before. But I think, as long as we have systems in place where departments of health can offer free testing, community-based organizations, we've talked about churches being involved in HIV testing, but in particular our medical systems, and destigmatizing HIV testing and making it alongside as one of those preventive services that you should be receiving, a screening service similar to, breast cancer screening with a mammography or an ultrasound, colon cancer screening with a colonoscopy, a flu shot every year. These are the kind of things that should be routinized, and HIV can be a part of that. Yeah, so I think there's a lot of different areas we can work on.
Yeah, but circling back to this provider though, we've had conversations in the past about his responsibility, and all primary care providers' responsibility, and other providers for that matter, to even think about this. We really need to make sure this is on the radar. And we talked about the process of opt-out testing, and they, the folks in his practice, they were not even aware that this was a possibility for them to integrate into their practice. So when we spoke about the way they could shift their offer of testing, for example, saying something like, we test all of our patients for chronic health conditions, including diabetes, HIV, kidney disease, and so on. Despite approaching it that way, he responded, well, I understand what you're saying, but it's really awkward for me to offer HIV testing to my patients because I've been with them a long time. And why would I all of a sudden start asking them to be tested for HIV. So, and I've heard that multiple times before from providers. And so my response to that then is, well, what about liability? Because HIV is now a treatable disease. This is not the 1980s. So we have a responsibility to treat people for preventable infections, treatable infections, and that gets their attention. But I think we still have a long way to go to get primary care providers in particular to embrace routine screening and opt-out testing.
Yeah,
What's your experience?
no, I agree entirely, and I think, again, I said providers are always kind of the main barrier with things. Even when we talk about pre-exposure prophylaxis, providers are the barriers because they're often saying to patients, well, why can't you just use condoms? Or why are you having this type of sex? Instead of saying, well, okay, you're telling me what you're doing and here's my job in, making sure that you're doing okay. One thing that encourages me when we talk about, say, facilitators of HIV testing, and I think to your point of primary care providers maybe not seeing it as being on the radar of something we have to do with our other routine screening practices, is that even when I took the board exam, the board recertification exam for internal medicine, there were questions, not only I took a prep course where we talked about it, but there were also questions in the exam itself. I was encouraged to see a question on pre-exposure prophylaxis. I was encouraged to see a question or a couple questions on HIV testing or screening. So I think that's where it has to kind of get integrated into things. And so that's only one aspect, obviously, because a lot of these providers' personal biases are going to, prevent them from doing that. But if we standardize this within the training services, within the recertification, within the CME, and people are forced to kind of deal with this on a daily basis, then it's going to become more of a part of their routine practice, hopefully. It's going to take a lot more than that, obviously, but I see some things moving along culturally where HIV screening is considered part of the landscape along with these other chronic diseases or chronic conditions. So hopefully that can make an impact over time.
We hope you enjoyed the practice of medicine. For more episodes in this series or the SMA's Business of Medicine podcast, go to sma.org/podcasts or subscribe to us on Apple Podcasts, Google Podcasts, Spotify, or wherever you get your podcasts. For more information about the SMA's mission, please visit sma.org, and thank you for joining us.